The moment you bring the child or the individual to the specialist, then you're able to get better direction on how to perform some, routine procedures that may seem a bit difficult, but on guidance, you could actually do it the best way. So prevention here is key. With oral hygiene, you can make a huge difference in a child's life. Hello guys, Dr. Kendi here and welcome back to My Oral Health Diaries. I hope you enjoyed last week's episode where we discussed the difference between pediatric dentistry and general dentistry, and we're still going on this month with pediatric oral health care, and today we're going to be discussing oral hygiene in children. So we had a little episode where we talked about it before, but today we're going to go in depth with our specialist. We're also going to encourage us that if we have any questions with regards to oral health in children or pediatrics, please comment in the comment section and we will make sure that we address these comments. So I'm going to welcome back our specialist, pediatric dentist, Dr. Thomas Munyao Jr. Thank you for the good job. Thank you for the good job you guys are doing. So today we are going to be focusing on oral hygiene in children. So first, maybe we can just start with how important is oral hygiene? Like, is it important to brush our children's teeth?
Yes, it is. It's I think it should be a rule that all children's teeth need to be brushed from the point where they start growing, around the age of 6 months. We usually say once the first tooth grows, you need to start introducing those aspects of oral hygiene practices to your child, either by use of a cloth or use of small silicone brushes, so that your child gets used to this habit as they grow up and becomes part and parcel of their life, rather than wait when they're 2 years old or 3 years and now that's when it hits you. You get a light bulb moment, you're like, oh, their teeth, they need a brush, let me start. And that time the child is used to a certain routine, they'll start fighting you and resisting you. And since now our world, people are more impatient. I think nowadays parents are more impatient, if I'm wrong.
No, I think we are
and
more
busy.
Not really impatient. I feel like we are more soft. We
are trying to be good parents. We're trying to be what our parents wanted to us.
Yes,
And that in the long run we end up what is it called? Comforting our children more instead of teaching them the right things and the right ways, and like telling them, listen, you need to brush your teeth 2 times a day, whether you like it or not. But now you'll be like, oh, please, my son, baby. Oh, my princess, oh, my dad.
Yes, my princess. So, do we start cleaning our children's teeth, mouths when they have teeth, or before? At what point do we start practicing oral hygiene in children?
Actually, before. Sorry, I never mentioned that earlier on. It's actually before, because we know before a child is, let's say that's 6 months or 5 to 6 months when the first tooth erupts, the deciduous incisor, we usually have the gum pads, which act like the teeth now in this situation. So it's usually nice for the caregiver after breastfeeding even to clean the gum pads with a clean white cloth, and also massaging them. This helps in soothing the child and also improving the blood flow around the gum pads.
So at what time would you recommend for the breastfeeding mothers to clean the oral cavity? Like at what point?
I think from around 3 months is okay if you're able to, because children are different. But if you're able to start at 3 months, and you don't have to do it all the time because at least there are no teeth. Just the whole concept of just massaging the gums of the child is soothing for them, and it improves the blood flow, which also promotes growth and development. Well and good. But if you're not able, but at least we say by the time the first tooth grows, you need to start ensuring that you clean the teeth, either with a cloth or with a silicone brush, or even in an ideal setup, you should be having a dental home by then.
By 1 year.
by 6 months.
By 6 months.
Yeah.
So at 6 months, we should be bringing our children
Yes.
to you.
Yeah, so that you advise you. This is more of prevention now.
Yes.
Yeah, because we say prevention it's way cheaper in terms of time and money, and it actually improves the quality of life of your child. Yeah?
So most mothers, like most of the questions I get about this breastfeeding is, so my child, I'm breastfeeding them on demand. Okay, so when they're hungry, I'm breastfeeding. So at what point do I decide, okay, I'm going to wipe their mouth now at this time?
That's a very hard question, yeah? That's a very hard question, yeah, especially in mothers, the children who do not have any teeth. Yeah?
Yes.
There's no particular time you can say I have to do the whole cleaning thing of the gums after every breastfeeding session. Maybe you can be doing it twice a day because they're not teeth. But we say now once a tooth grows or teeth grow now, you can start doing it after every cycle, yeah? And usually say it's better to have a routine.
Yes.
You shouldn't be doing it on demand, like...
The breastfeeding?
Yes. Not like, for example, like let's say you have a daughter or a son, yeah? And then like every 2 hours they want to be breastfed. You know, also that increases the frequency of breastfeeding, which is also a form of snacking but on liquid foods, yeah? So you know, every time you breastfeed, what happens to your pH in your mouth? It drops. It becomes acidic. So when the pH becomes acidic, you have a higher chance of developing cavities. So if you're going to breastfeed frequently, you just need to be ensuring that after every breastfeeding session you clean those teeth with a clean white cloth, just to minimize the chances of your child developing a cavity. If you're able to do a routine, the better. The earlier you put your child on a routine, the easier it becomes for you as your child grows. Because I've seen caregivers or parents who are struggling with children who are 2-3 years. Because of that frequent breastfeeding, some of the kids have not stopped breastfeeding. Some, even though they have stopped, they are just used to snacking all the time. So they end up developing cavities.
And when we are using the cloth to clean the child's teeth, what liquid are we using? Is it just plain water? Would you advise to put some salt or any, type of mouthwash? What do we use?
It's advisable to use plain water, but also seen some literature where they suggest you can use saline water, or basically water mixed with salt. Because water mixed with salt is a good, it has been used for so many years for preservation of food, and it has also been quite beneficial for human health over the years, so it's also a good alternative. We usually discourage parents from using a mouthwash in a child because there's a higher probability of the child swallowing the mouthwash. So we usually don't recommend use of a mouthwash. Just using a clean white cloth. That's when I say white, because with white you're able to see if it's not clean. If you use a black cloth, you may just end up
So we are using a warm, a white towel with warm water. We can either mix it with salt. Is there a specific amount of salt we are using in the water, or we just dissolve as
Actually,
much
tell
as
parents
we can?
a pinch of salt, because you're not going to mix like a whole glass of water. So you just need a dip. Just a pinch of salt.
Just kidogo.
Kidogo sana.
Okay, good. So please, parents, it's not expensive. We have salt, we have water. The cloths we are talking about, the Muslim cloth, the old one, you can get a piece and just dedicate that small piece to cleaning the oral cavity of the child. So now what we are going to discuss is how now to take care of these children age-wise, like per age group, so that we have better instructions on what we need to do. So now, Doc, we have this child, this neonate, let's say, who we've been wiping, hakuwa na meno. Sasa, the child has developed teeth. So now we have started using a toothbrush. Is there anything we put on the toothbrush to clean the child's teeth?
Actually, if you ever visit a supermarket, you'll see the toothpaste sections. There are different toothbrushes for different age groups. You can pick those toothbrushes and toothpaste for different age groups. So you can pick the toothbrush for that specific age group. Also, you have to consider the size of your child's mouth.
So, Doc, do you mind elaborating further or just explaining to us with regards to the different age groups, how much paste are we supposed to use? Should we use a different toothbrush? What should we do differently as the child grows?
For the different age groups, there are different sizes of toothbrushes which you can use, and also what usually really matters is the amount of toothpaste you're going to use. For example, in children who are below the age of 6 months, who haven't gotten any teeth, you don't need any toothpaste, you don't need any toothbrush unless you can get the silicone brushes. They usually have a nice massaging pad at the back.
Those are good, yeah.
Yeah, they are quite good. You can use them on kids who do not have any dentition. But once they develop teeth, you can still continue using the silicone brushes, which you basically stick it on your tooth and to brush even that single tooth, if you're able to afford it. If not, you can use the clean white cloth. As the child progresses between the ages of 0 to 2 years, you can use, we usually say you can use either a smear layer of toothpaste. Smear layer means a very small amount. Some toothbrushes actually have indicators of where you can actually place your toothpaste. Or, as I alluded to earlier on, it's not a must use a toothpaste in this age group. The mechanical action and consistency, it's what really matters. From children above 2 onwards up to 6 years, especially say 3 to 6 years, you can use a pea-size amount of toothpaste. And the head also, I forgot to mention the head in the earlier groups, the head should be small in this age group. It should be extremely small, not like smaller than like a green gram, but you'll see them in the supermarket. Don't buy those big ones. I've seen some parents buying their kids huge toothbrushes.
That's why to shake up.
The toothbrush is the size of like 60. So, and you wonder how do you expect this child to clean their teeth? And most kids usually complain they feel a lot of pain when they're brushing. So when some of them hate brushing, they'll go to the bathroom telling you they're brushed, but they're just So from 6 onwards, you still say maintain that pea-size amount of toothpaste, but the brush will change because now they're developing the permanent dentition, or the permanent teeth are growing. For that matter, you can get there's some toothbrushes where they indicated there that they're for the developing teeth, for mixed dentition or mixed teeth. Mixed teeth means you have baby teeth and permanent teeth. They're so nice because you find that some of them, the bristles are arranged. Bristles are those spiky things on the surface of the head of the toothbrush. Some of them are arranged in a zigzag pattern, enabling you to clean the different types of teeth. That is the baby teeth and the permanent teeth at the same time. Some have the outer bristles being longer than the center ones, ensuring that you're able to brush your teeth well. And I've seen them working so well for kids, in that age group of 6 to 12 years. Some even extend up to 13, 14 years. Once they go into proper adolescent, after 14 years, when they have all the permanent teeth, you can get them a toothbrush that is similar to the adult one, but now whichever the child is comfortable with, whichever they like. If they like a pink toothbrush, whatever they like.
Pink one.
But for kids, try and get them brighter toothbrushes because I've seen they are more attracted to brighter colors. And nowadays in the market, I've seen there are so many types of toothbrushes.
Very cute.
Cute ones. My son keeps asking for a Batman toothbrush. I don't know, he knows Bruce Wayne. I don't know how.
You have to look for.
Now the thing is Spider-Man.
And
now that we're in the month of love, Spider-Man should be selling a lot of toothbrushes. His color is
Why are we selling toothbrushes in the month of love?
Oral hygiene.
Oral hygiene.
It's one of the most important
Yes.
aspects. That's why you see you have the pediatric oral month in February. Because we start training you good oral hygiene
early.
On the 14th.
Most parents keep saying that they're unable to brush their children because they will not cooperate completely. So how would you advise such a parent that mtoto amekataa kutulia ni brush? So what do you advise that these parents do for their children, considering vile tuko very soft?
What I'll advise those parents who are soft.
Yes.
Become hard. They need to become hard.
We have to force.
Not force, because also when you force, you can easily traumatize the child with the toothbrush. You remember the head has the bristles and the plastic.
Yes.
And I've seen cases of kids being injured on the gum or on the palate with the toothbrush. So you don't also want to do that. You just have to be hard and firm and give them conditions, and also maybe you can give them incentives. This is for children who can understand and comprehend.
Yes.
Like I know nowadays kids, most of them are addicted to phones or cartoons or something. So you tell them
they talk about Comelon Doc.
Comelon, those things. So when they refuse to brush, you tell them no more Cocomelo, no more SpongeBob, no more something. If they so I've realized when I tell parents to try that technique, it works so well.
Yeah.
Yeah, because basically you are trying to enforce something good by using something they like as an incentive now. It's not blackmail, or you're teaching them corruption in their hands. Just
some would say it's corruption though.
But a parent has to do what they have to do to ensure that these things are followed. Yeah. Also, one thing I alluded to earlier on is the introduction of these oral hygiene practices at an early age. This ensures the child knows that this is something that has to be done. The same way they know they have to shower, the same way they know how to sleep. Also introduce this practice early. The earlier you do it, the better. Yeah.
Okay. So
and also for some parents, I know some that try those things and they don't work. Sometimes it's also nice to switch. I've realized nannies are more effective than parents.
Yeah, sometimes
because they spend more time with the kid. So the kid, the baby usually listens to the nanny more than the parents. So sometimes when you tell the nanny to take over, it works wonders.
It works better.
It's quite unfortunate.
But that's what the situation is. It is what it is. As parents, I think the biggest worry is normally that you fear your child is going to get hurt. But I mean, even Dr. will attest, like, it's better for you to feel uncomfortable when you have to, make sure the brushing is being done, rather than your child getting a cavity that needs to be fixed and we have to bring them into the clinic. Even if you sedate them or you put them under GA, trust me, like, it's a bit more traumatizing for those of us we are calling soft parents. It's more traumatizing. So I think it's better for you to just, stand firm. Stand your ground. If the child has to brush, then they have to brush. So let's try and work a bit harder. We have to work a bit harder.
And just be more committed. If they see you doing this thing of brushing, they'll also copy you. Most kids usually copy what the parents do. So sometimes just even try and brush with them. Just be there with them. Create that time.
Yeah.
2 minutes of your day will not make you lose a promotion, will not lower your profits in your business. Just create that time to spend with your kids. Because these are the same guys who we want them to grow up to become responsible people. And it's these small deeds and actions that actually do mold them.
Yeah. That's true. So there's also another question that parents come with. The same way we advise adults to brush and do interdental cleaning, like flossing, do children need to do interdental cleaning?
Yeah, they do. There are some who have spaces, especially between the baby teeth. There are quite a number of kids who I've seen who have. Usually we say there has to be like about some few spaces, maybe 2 or 3, 2 actually per jaw.
Yeah.
But you find some kids have spaces everywhere, and when they're brushing, the brush is not able to go everywhere. So they can actually get the size 0 interdental brush to brush in between their teeth. But this has to be done by the caregiver, not the child.
Yes.
Because the interdental brush usually is so tiny, it can easily traumatize their gum.
Yeah.
But only that we usually recommend in certain situations where you see the child is not able to maintain good oral hygiene. But there are also some kids who have tight contacts, especially those ones who are transitioning between the baby teeth to the permanent teeth to full permanent dentition.
Yeah.
There's some patients who have to floss because they don't have spaces. So usually advise the parents to do the flossing for them, so as to minimize chances of them developing cavities between the teeth, because that's also another area where cavities can easily develop. And the earlier you inculcate this practice in the kids, the better.
The better.
Yeah.
Okay. So let's say, as you said, like, we need to sacrifice our time to actually perform oral hygiene routine for our children.
Yeah.
Let's just say maybe it's impossible or the parent is not there, or how do we monitor that these oral hygiene practices are going on well? How is a parent able to tell that, okay, I'm doing a good job, or Sifani Poapa, I need to improve? How do they monitor?
There's some disclosing agents which you can get from your dentist can order for you from a supplier, which you can be giving your child to suckle. It's like a sweet. So what it does usually stings where there's a lot of plaque. So if you see you've been carrying out your oral hygiene routines and practices over a period of 1 month, and you disclose and you see using that tablet, you see the color, usually most of them are pink. You see the teeth are turning pink. It means that you haven't been cleaning well.
Yeah.
But also using the human eye, you can tell when you haven't cleaned well. You usually see a white layer around the tooth surface, especially closer to the gum, we call that area the cervical area. It means you haven't been focusing so well. Or even sometimes you can take even the plastic part of adult dental floss and just rub it on the tooth surface and just see if there's anything coming out. If you see a white smudge coming off the tooth surface, it means that's plaque. You haven't been cleaning well. Yeah, so those are some of the easy methods you can use. The disclosing agent is more extreme, but if you're not able to access such things, just use of your eyes and just also getting something
to scrape off
the tooth surface. Yeah, just see.
I think the disclosing agent works really well, especially for adolescents, because they appreciate why you are actually telling them that they are not brushing properly. So if you have a child you've been fighting with and they are refusing to brush, if you get the disclosing tab and they're actually able to see what you're talking about, then it's easier.
Yeah.
Also, do baby gums and teeth behave the same way that adult teeth behave? Like, can they get gum infections? Can they get cavities? Can their teeth fall out at an early time? Like, are they just like adult teeth?
Usually say baby teeth are different from adult in terms of structure, color, size, and all. The gums also it's different because it's still developing. That's why you never do anything permanent in a child who's growing, because the gum hasn't yet fully matured.
Yeah.
But the gum is still vulnerable. The teeth are still vulnerable to the same diseases that adult teeth get.
Yes.
For example, a child's tooth can get dental caries. They can fall off after an incident of trauma, like if they play sports and they get it, they can easily fall off, or they can get intruded inside the gum, like for an adult. They can also get what you call pulp disease. What most people know is root canal. When they hear root canal, they just know it's the end of the world.
Yeah,
like also children undergo those procedures because they never tell the caregivers that your child needs a root canal, which we call pulpectomy.
They tell you that they don't want those things.
Yeah, it's like you discovered a new term for them. Like, daktari ulitoa kwenye nyumbani.
Unataka pesa.
I just want to make money, but
it's not.
Also, the teeth can undergo those procedures. They also get gum disease quite a lot, especially in malnourished children.
Yes.
A lot, and who have autoimmune diseases. They get a lot of gum disease. Also, you have kids who are quite unfortunate to develop what you call AA. Some kids get aggressive perio, and they start even losing teeth by the age of 16. And even I've seen one at the age of 12 already losing their first permanent molars. So they're also vulnerable to the same disease as adults. Even those kids who have underlying systemic conditions like diabetes type 1, they develop similar conditions to their adult counterparts.
Okay. Yeah. So for people who have special care needs, patients with cerebral palsy and all that, are their caregivers supposed to perform any oral hygiene routine differently? Like, is there any advisable different way to do it? How do you go about that? Because they have to take care of their teeth as well.
Yeah, especially for the kids who are taking care of people who have special needs. Like, let me go to the extreme spectrum. Those are people who have CP, cerebral palsy, Down syndrome, autistic children. They need to be more vigilant. They need to be more patient. Actually, I tell them, patience is the key. It's not about your technique per se, it's just being patient. Take more time when they're trying to clean those teeth. Even though the child is uncooperative, they just have. I usually sometimes say, if you're not able to do it by yourself, get someone to support you. Get someone who can hold like the child's head to be more steady and firm. Someone who's loving. Because some people are usually so rough to children. So when you're rough to these kids, especially autistic kids, they also can become very aggressive. And some of them have a good memory. Because autistic kids, it's a whole spectrum. Autism is a whole spectrum. So some of them have a good memory and they'll just associate toothbrushing with bad things. So you will never change that habit. So just get someone who's loving, trying to explain to them those things are able to understand something, and just be consistent. You'll find after some time the child gets used to this practice. So patience is key. Patience and consistency.
Okay. So I think what here on My Oral Health Diaries would like to encourage is that if you're a caregiver or if it's a society that is taking care of individuals with special care needs, the best thing is that you always seek guidance from a specialist who is able to advise you further. The moment you bring the child or the individual to the specialist, then you're able to get better direction on how to perform some, routine procedures that may seem a bit difficult, but on guidance, you could actually do it the best way. So prevention here is key. With oral hygiene, you can make a huge difference in a child's life. Thank you again for joining us on this week's episode of My Oral Health Diaries. We really appreciate the support. We are still excited about Pediatric Oral Health Awareness Month. Make sure you keep liking, sharing, subscribing, watch these videos and learn more about oral health. Make sure you're making a better decision with regards to oral health for you and also for your children or the people you're actually looking after. See you again on the next episode of My Oral Health Diaries.
So we'll have to cut. I've forgotten the name. Actinomycosis, yes. Actinomycosis acetomocometers. Hiyo
Address it very okay.
Yeah. Hiyo umekimbia basi. Wacha umekimbia.